Adverse childhood experiences. First of all, my name is Anthony Hernandez, and the reason I start with adverse childhood experiences is because it's something that is near and dear to me and something that not a lot of people know about. So using that phrase over and over and over is something that I hope to use to bring awareness to this issue. So let's start with what is adverse childhood experiences. So basically, it started with a Kaiser Permanente study in which they started to look at comorbidities in their patients and to try to find a link between what they were seeing in their patients and any type of links they saw in just in their health. And one of the things they saw was a prevalence of childhood abuse, and not just childhood abuse, but adverse childhood experiences such as divorce, and they linked that with comorbidities growing up, such as diabetes and even drug use and things like that. So that's basically where adverse childhood experiences began, was the Kaiser Permanente study. And so what does that mean for me and my research? Basically, what I wanted to do was to take the information that has been being gathered about adverse childhood experiences since 1999 and take the information and make it relevant to the community. Being a pediatrician, now start in residency, I believe one of the best ways to access the community in which I'm looking to reach is through my pediatric clinic. I think pediatricians and pediatric clinics are in a unique position to reach a breadth of the community in which they serve. A lot of times adults will neglect their health, but rarely will parents neglect the health of their children. And not by any means am I saying all children are healthy. What I'm saying is that usually we are going to see the follow-up in the parents after birth. Rarely have I seen parents miss the 2 week or the 2 day follow-up after they've had a baby. And that allows the pediatric clinic to reach a lot of parents about information that is vital for the health of their children. And so the understanding of adverse childhood experiences needs a avenue in which to reach parents. Parents are very understanding of depression. I think depression has done a really good job to kind of bring that to the forefront. That is something that is affecting the health of the human community. Of course, infectious problems being from COVID has been brought to the forefront to parents. Even things such as eating and playing and how much time they're spending on video games have been very prevalent. But it's very hard to talk about abuse. It's very hard to talk about divorce and adverse childhood experiences that could affect kids. So because of that, I've seen the best way to reach my patients is through information that they can take home with them. And one of the things would be a pamphlet that we can give patients to really understand and to learn about adverse childhood experiences. So that's where most of my research paper is based on, is really getting the information that's out there, that has been studied, and the breadth of data that we've had collected from the BRRF to give to parents, because it's very hard to find the information out there, even for a doctor or a health worker, let alone for parents to find the information. Adverse childhood experiences is not something that you're seeing on TV. It's not something that you're seeing posters on. It's very new in the health field for prevention of comorbidities later on in childhood. So I think one of the best ways to bring it to the forefront would be to reach parents early in their childhood care, the care of the children, and pediatric clinics will be the best place to do that. So I've gathered all the information. I've related the information to a pamphlet that we can reach the parents, and I think ultimately that's where my research paper and my research has gone into. I was very lucky to be a part of this. It was a great experience, especially being in a subject that is very important to me, being a pediatrician, and looking to be a general pediatrician and reaching the community. The master's in public health and the information that I've gathered within my time here I was able to take everything I've learned, gather data, and implement information for parents. That's it. Thank you.